I'd like to welcome everyone to our Alexander County Board of Commissioners regular meeting, March the 10th, 2025. And at this time, we will ask Commissioner Josh Lale to lead us in the invocation, and Commissioner Larry Yoder will lead us in the Pledge of Allegiance following.
Heavenly Father, thank you for this day. Thank you for allowing us to gather here. Thank you for each and every person in attendance, for them taking time out of their busy schedules and lives to be a part of the Alexander County government and our due process. Heavenly Father, we may not all have the exact same opinions on every issue, but we all have the same agenda, that being trying to make life in Alexander County better. Dear God, please be with us during this meeting. Help us to make wise decisions that benefit the citizens of the county. Help us to be examples. In your name we pray. Amen.
Amen. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This time, do we have any commissioners with a report?
Well, Mr. Chairman, I guess, everybody knows that several of us went up to Washington, and three of you visited the two senators' office, Senator Tillis and Senator Budd, and the meetings that we had there at the NACO conference was very good, got some very good information, and it was good to be there and get that information on the days that we had things. We had some very good speakers, and you gentlemen did a nice job of going over to see the senators and delivering a plaque, a wooden plaque that was made out and carved out, and delivering that to both the senators, and that was good. And we got good information and things that we can bring back to continue to help us to improve the quality of life in Alexander County.
Mr. Chairman, I'll just echo Commissioner Yoder's statement. We did, the NACO conference, went well. It's always good to spend some time with, folks from other parts of the other parts of the state and other parts of the country. We were able to meet privately with both of our U.S. senators' staff. Congress was in session, so those guys were pretty busy. But Commissioner Pennell and County Manager and I met with both Tom Tillis' staff and Ted Budd's staff, and basically just, biggest thing, we wanted to make them aware that Alexander County's here. And, we're small, we're rural. We don't always get the attention that, the Mecklenburg counties, the Wake counties, those places. But we want to make sure they knew who we are, know where we are, which they do. But the majority of our discussions were dealing with, some issues that pertain to rural North Carolina, and how there are certain things that, even though life is not fair, there are certain things that are not being handled fairly when you look at urban areas and rural areas. And so those conversations, I thought they went well. I do have one other little thing. The Bethlehem Park renovation is finally finishing up or coming to fruition. And there is a festival planned to celebrate the Bethlehem community, but also to celebrate the park and its renovations. And it's actually the Bethlehem Lions Club and the Bethlehem Lions Club and the Bethlehem Ruritan Clubs are working together to put this on. And it's actually called Bethlehem Spring Fest. And it says, the information I've seen says first annual. So this is something planning on doing each year. Bethlehem's first annual Spring Fest will be at the grand reopening of the new Bethlehem, the new and improved, the improved Bethlehem Park. It is Saturday, May 17th from 9 a.m. to 4 p.m. I know they're going to have some vendors. They've been in touch with several different parts of the county government, with recreation, with Gary Herman, with some folks, trying to put together what will be a fun day, and obviously, want to invite, any and all to come to help the first annual Bethlehem Spring Fest be a success.
Any other commissioners have a report? All right, at this time, we'll move on. Do we have an adoption of agenda?
Mr. Chairman, move to adopt the agenda as presented.
Is there a second?
Second.
All in favor, raise your right hand. Motion carries unanimously. This time, we're going into public comment. We have 5 folks that have signed up tonight to speak. So I'm going to go over some rules to go by. The public comment period is intended to allow the Board of Commissioners an opportunity to listen to citizens' comments and concerns. It is not a time for the board to discuss issues or answer impromptu questions. A time period of 15 minutes has been established for public comment at the beginning of the first regular meeting in each month. Length of comment for each speaker is limited to 3 minutes. Please select one spokesperson to represent a group of citizens with the same concerns or questions. Comments are to be directed to the board as a whole and not to individual members. Citizens will be expected to be civil and courteous in their language and limit comments to issues of public concern. Topics requiring further investigation will be referred to the appropriate county officials or staff and may be scheduled for a future agenda. Any citizens wishing to address the board during public comment shall call the clerk to the board prior to the meeting to have their name placed on the list. And I think we're going to have a stopwatch running on the screen. There it is. So when you come up, your 3 minutes will start, and just pay attention to the screen so we don't have to interrupt or close down the comment. Anyway, first up will be Tennille Howman. Did I say the last name correct? Yeah, that's fine. On foster home licensing.
So I'm not going to waste time introducing myself again, but I did want to just go back and talk a little bit about from when I was here last month. Because I was a social worker at Alexander County DSS from 2019 until March of 2016. And when I left the agency, we had 32 licensed foster homes. And also during that time, I had completed 13 to 15 adoptions the year that I left and the year before that, and I was supervising an entire team. If you look at the standards for the state for each of those programs, you'll see I was doing the job intended for 3 or 4 people. I completed a monthly report as a supervisor, and each month I would state it's too much for one person. I'm not here to complain about this for myself. I'm pointing it out because it saddens me to see this continue to happen. Over and over, the people that know what to do are given more and more until it's too much, until they are unable to balance work with life. The ones who do all the work eventually become overwhelmed and quit. Then that leaves the ones who are not capable and who do not have leadership skills to be promoted. Last month, I spoke about the agency vacancies and the crisis of having no foster care social workers. Since I was here last month, The one foster care social worker quit. The one supervisor quit. The supervisor who quit was doing her job, but then was asked not to finish working her notice. It's difficult for me to understand why we would burn a bridge with someone when we already have no one. Even the month before, they fired the other foster care supervisor, and I'm not saying that there were not things that she needed to work on, but I also don't understand why they would not have asked about her being demoted or a work plan so that we could have kept somebody there to hold those cases. The social workers and supervisors are not getting the support and guidance they need to do their jobs. I would encourage you to start asking more questions about why people are leaving. This brings me to foster home licensing. The role of licensing has never been given enough priority in our agency. The licensing social worker is often asked to carry out multiple jobs. The current worker has over a full foster care caseload. The previous licensing worker, who they also talk a lot about, that's who they blame a lot for the state of licensing being such a mess. And I know that there were a lot of issues then as well. But he was also asked at one point to be put in investigation. So it was never and has not been given priority for years. And I understand that. They're just putting them in positions because they're trying to put out fires. But it's also created this issue where we don't have any foster homes in our county anymore. We're down to, I think Carrie said in the December meeting, we were down to 16, and I think that's probably even less now. More and more of our kids are being placed outside of our county. This in turn puts more and more stress on the social workers having to travel further and further to visit the kids. It puts more and more financial strain on the county because the placements cost more. And when we don't have a licensing worker who can give the job the time and attention it needs, we start to lose the foster parents that we do have left. They don't receive the support that they need to help our kids. And licensing and relicensing paperwork doesn't get completed, so families become frustrated and transfer their license to another county or a private agency.
Time's up.
Okay.
Thank you. Next, we have Paul Kelly. Brenda Price. I'm sorry. Sorry, Brenda, I knew that.
And as Tennille said, I will not waste my time by telling you who I am, but I will say that I've been foster parent in this county for over 40 years, and I've fostered over 200 kids in my home. I have had a lot of dealings with the Department of Social Services, and I will just read this from the website. North Carolina Department of Health and Human Resources and the Child Protective Services strives to ensure every child has a safe, loving, and permanent home. I am here tonight because our foster care system is broken, and the children who need us most are paying the price. I have spoken with a lot of the foster parents, social workers, current and past, and child advocates over the last several weeks, and what I have learned is shocking, heartbreaking, and unacceptable. Foster parents are frustrated about the turnover and not having anyone at DSS they can count on for correct information, advice, or support. Some are even afraid to speak up because they're afraid that they will move the children. Social workers are leaving in drones, not because of pay, but because of toxic leadership, lack of support, and impossible caseloads. Several past social workers expressed in the beginning they loved their job, loved the kids, and even thought they would retire from there. Foster children are being sent to homes outside the county, ripped away from their schools, communities, and families because we have lost over half of our licensed foster homes. One child had 9 different social workers in less than 2 years. Supervisors do not know the policies. Cases are falling apart in court. Adoptions are being delayed for no good reason. Many foster families have told us that they want support and were told by a social worker if they wanted support, they would have to transfer to another county. Now, what kind of message is that? I ask you, if this was your child in DSS custody, would you accept these conditions? Would you tolerate this level of failure? We must do better, and you must do better. We are asking for demanding some action. We'd like to hold DSS accountable. If they are failing the kids, they have no business in this department. Support the social workers who do remain there. They are drowning under impossible workloads. Give them the training, leadership, and resources they need. Give them some experienced and knowledgeable supervisors who care about the best interests of these kids. The time for excuses is over. The time for action is now. Please, these are the kids of our county, and we need to do better for them. Thank you for your time.
Thank you.
Thank you, ma'am.
Thank you, Brenda.
At this time, George Holloman.
I brought a team with me, and I want to say Terry Estes, Mary Hope Milligan, Dale Little, Rudy Hollingsworth, Scott Henson are on the team with me. In 1775, the Continental Congress set aside a day of prayer for a fledgling nation. In 1952, Harry Truman set aside a day of prayer. And then in 1988, Ronald Reagan amended that resolution to set aside the first Thursday in May for the National Day of Prayer. That's what we want to do in our community, and hoping that you will join us in that matter. That day, the President of the United States and all of the governors will declare May the 1st, 2025, National Day of Prayer. The town of Taylorsville will proclaim, and I would like for the county commissioners to proclaim May the 1st, 2025, at noon, National Day of Prayer, to give us time to pray for our community. Our team prays every week for our community, praying for an awakening, praying for light to come and dispel some of the darkness out of our county. So if there's no opposition to that, I will get with the clerk and the county manager and sort out the details of doing this on the courthouse property in Taylorsville. Thank you so much for your time.
Thanks, sir.
Thanks.
At this time, Riley Oates with U.S. Small Business Administration.
I don't see him. I don't see him.
Is Riley Oates here? All right, we're going to move right along. Tyler Brown?
Good afternoon. Thank you, County Commissioners, for giving me the time to speak this afternoon. I want to start off by saying I appreciate all that you do. I hate that some things pull you away from focusing on the entire county and bringing jobs, growth, funding towards our schools, and making sure our current tax revenue is spent appropriately for the entire county, including the residents of the Bethlehem community. I am a lifelong resident of Bethlehem and Alexander County, outside of the years that I lived away for college at Appalachian State. I am very invested within the Bethlehem community as a farmer, business owner, board member of the Bethlehem Fire Department, member of Bethlehem Baptist Church, and my wife is an active board member of the Bethlehem Business Association and chairman of the Bethlehem Baptist Daycare. We have a 6-year-old in Bethlehem Elementary School and a 3-year-old in Bethlehem Baptist Daycare. We raised my family in this community and county the same as I was raised. As many of you know from conversations I have had with you, and along with the hundreds of residents that I am sure have been in contact with you from Bethlehem, I am here tonight as a voice from Bethlehem that can confidently say the overwhelmingly majority of us are against incorporating Bethlehem to form a new city. I want to inform those listening to join our Facebook group, Bethlehem Against Incorporating and More Taxes. You can also find impacts and facts about incorporating our community at bethlehemnc.com. We have also started a very informative podcast for things happening in Bethlehem called Let's Talk Bethlehem, with guests from residents new and old involved within our community to make it an even better place to live. We have researched and been in contact with many local and state officials to compile our shared information on these resources and how this will impact our community of Bethlehem. We have been in contact with each General Assembly member, who you can find on our Facebook page and website with their contact information. We ask all of you listening to contact these individuals to help reiterate that this must come back to Bethlehem for a referendum. This initiative, this is crucial as a referendum is not required. The group of individuals pursuing the initiative is tunnel focused on solving one concern for having zoning, without considering the doorway they are opening to our community for more bureaucracy, taxes, and potential ordinances to come within forming a city. This contradicts everything they are attempting to pursue with this initiative. This impacts all residents of Bethlehem and ultimately impacts all residents of Alexander County. I ask you tonight, as leaders of the county, to continue to help raise awareness for all residents of Bethlehem, along with all residents within the county regarding potential budget changes and potential tax changes if this continues to move forward. Help us bring this back as a referendum for all citizens of Bethlehem to vote on it. Thank you all for your time, and I appreciate everything that you do.
Thank you.
Thanks.
That will conclude our public comment. We thank everyone that chose to make a comment tonight. At this time, we have a public hearing, text amendment TA-25-01, Land Development Code, be given by Patrick Creech. Do I have a motion to enter a public hearing?
So move.
Second.
All in favor, raise your right hand. Motion carries unanimously. Mr. Creech, podium's yours.
Thank you, Chair. Thank you, Board. My name is Patrick Creech. I am the Senior Planner in the Planning and Development Department, and I'm here to present a series of proposed text amendments that seek to bring a little clarity to the Land Development Code in some parts. This was approved by the Planning Board on February 13th, and I will briefly walk you through some of these text amendments and answer any questions that you have. It begins with a series of typo corrections. I won't go through all of those, but when the Land Development Code was passed, there was a series of just small mistakes that I've found since I've come in, and just seeking to correct those. More importantly, starting on page 5, I believe you have the same pages that I have here. We have the text that accompanies the Historic Overlay District. For Taylorsville, this was already passed, but this is the text to go into our Land Development Code. Following that, on page 6, you'll see a series of proposed changes for motor sports facilities recreational. We were approached by the Lions Club, and they wanted to bring back lawnmower racing, and the way that the code was currently written, there was no way that it could at all happen with what their facilities were capable of and what they were capable of. So we looked at a series of small changes that could expand the definition of a recreational motor sports facility to give them a little bit of leeway in terms of creating that. And then the next thing is the conservation subdivision update. Whenever a subdivision is created in our community, a certain amount of land is supposed to be set aside for either recreation or to maintain the environment. This was not very explicitly spelled out in terms of the purpose of the conservation subdivision. So that was added to the text of the Land Development Code, including also the requirement to submit an open space management plan that signifies what the purpose of that would be. It also reduces some ambiguity in the text about structures and how close they may be placed. There was some information here about the North Carolina State Building Code, but that's not for residences, that's for commercial. The building inspector said that he couldn't enforce that, so we seek to clarify that and then insert a definition. And then the final set of changes we would like to make involve stormwater regulations. These are all very important regulations, but In order for us to adequately evaluate these plans when they come in, we would need the advice of an engineer. We don't really have the capacity for that at this moment. They were supposed to go into effect on January 1st. We've asked for those to go into effect, January 1st of this year. We've asked for those to go into effect of March 1st of next year. In order for us to have a little bit more time to study it, we can always go back and put those into place earlier if need be.
Any questions from the board? Anyone in attendance tonight have any questions or concerns or comments in regards to Mr. Creech's proposals? If not, do I have a motion that we close public hearing?
So move.
Is there a second?
Second.
All in favor, raise your right hand. Motion carries unanimously. We do need to vote on this. If there's no questions or comments or discussion by any of the board members, I will call for a motion to
Mr.
approve.
Chairman, just have one question.
Mhm.
On the last page, it says the Land Development Code. Is that the only part of it that won't be in effect until March of 2026? Or is that for
That's great. It's just the stormwater regulations.
just the stormwater?
Those only recently were to go into effect, unlike the rest of the land development code. But like I said, we don't have the capacity to evaluate those stormwater regulations right now.
Okay, thank you.
So depending on if this board approves, the other changes would be effective immediately. Anyone else? Do we have a motion?
Mr. Chairman, I'll make a motion to approve text amendment 7, TA-25-01.
Is there a second?
Second.
All in favor, raise your right hand. Motion carries unanimously.
No,
You didn't?
no,
Oh, I'm sorry. I thought I saw you move your hand.
no.
All right, all opposed? We have 4-1. The text amendment was approved.
Yes.
We'll move on to ARPA Water Expansion Project bid award recommendation given by McGill and Associates. Come forward. Is that R.J. Mosley? Mosley. I'm sorry, sir.
Good evening, members of the board. Appreciate the opportunity to speak to you this evening, give you a little bit of an update on a project that has been ongoing for the county for a couple of years now. And so what you have in front of you tonight in your packets is a letter of recommendation and a certified bid tabulation that is that next step in the process of moving forward with the Waterline Extensions project that was initially named the ARPA Infrastructure Expansion Project. And so that process now has advanced to the point of advertising for formal competitive bids with construction contractors. And Bell Construction Company submitted the lowest responsible bid for that project. We did take one bid alternate in that project to evaluate a specific area that was a little bit different than some of the rest, so we could understand better how that construction cost there would stack up against the rest of the project. But overall, this project includes about 34,000 feet of waterline extensions at scattered sites throughout the county. And so these are areas where residents had over time requested extension of service. And so these are new extensions to new homes, new customers, including new taps for new meters for all of those folks who want water. That total bid amount, including the base bid and the bid alternate, is $4,081,668. And so with that, we would also recommend to the county to set aside in your budget ordinance $205,000 additional dollars, which is 5% of that total bid amount, just to cover any quantity overruns or unforeseen circumstances that may pop up that just happen with subsurface utility construction. So with that, again, we would recommend that bid award be made to Bell Construction Company in that amount of $4,081,668. With that, I'd be happy to field any questions that you may have about the project in general or the bid process.
Anyone from the audience have any comments or concerns or questions?
Mr. Chairman, is there a map that kind of shows?
So, we do have a slideshow. I can read off the areas. The alternate, one is the one that, is Hickory Hollow off of the Davis Code Road. It's 650 feet. It's potential 6 customers. I believe that they've been trying to get water for a while. As I understand it, they may have some issues with their existing water supply. And if you want me to, I'll just read off the names, if that's okay. And forgive me if I mispronounce some of these. I'm not from around here, as some people say. Stan D. Lay Drive, that's the one I'm worried about. I'm just gonna mispronounce. Stan DeLaw. There you go.
You got close, though.
Gina Lane, Dwight Drive is Area 1. Area 2 is been withdrawn. Area 3 is Caldwell Pond Road and John Klein Road. Area 4 is Jenkins Moose Road. Area 5 is
McAlpin.
McAlpin, sorry, Lane. I really should have asked Jamie before we came over here to make sure I knew all these roads' names properly. Advent Church Road, Shepherd Court, Heifer Lane, Kimmy Lackey Road, Glass Road, Shook Lane, Jimmy Shook Lane, Laura Ridge Lane, and then again, the alternate would be Hickory Hollow. And we will forward you the PowerPoint tomorrow.
Yeah,
Sounds like it's
so-
tying up a whole lot of loose ends that's been out there for a while.
That's some of the ones we've talked about for
Yeah.
years that we
Yeah.
needed to do in order, and also what we'll do, will help the pressure and everything also. So there's a lot of advantages to all this, and along with giving people water, it's still gonna help equalize some things to make things a lot better for the entire community in that area.
Yes, as you guys know, the commission's had an agenda to extend water service wherever they can for quite some time, and this is the latest list of projects. I think that PowerPoint that the manager's referring to was maybe presented to you guys, like the current board at that time, December 2022, somewhere in that time frame. So that's
Yeah.
the wheels of those projects do move slowly, but we are here today, so.
Well, that'd be good.
Actually, I don't remember the one part. Thank you.
Thanks.
Question, I have a question. Do you know if, with these additions, for them to have correct pressure, does that water tower have to be installed beforehand?
The water tank that you've got in service right now is, you got 2 different service areas or 2 different pressure zones. Part of this area is served off of the fairgrounds tank, and then the other part of this area is going to be served off of what we refer to as the Ellendale pressure zone. So that Ellendale pressure zone really reaches from the Ellendale tanks there at that convenience site all the way back down to Bethlehem, there at the booster station, which is in that general vicinity.
Speaking of the tank on 127?
Mm-hmm, it is. So that's generally the corridor of that, and then that kind of spreads off of 127 as the backbone to serve a lot of those areas. Your new tank that will be erected in Bethlehem is going to create another pressure zone that will serve areas more east of 127 and out Rink Dam Road. And so final determinations on where the county and the city of Hickory decide to kind of valve things off to separate the pressure zones is yet to be determined. But that will help open up a couple of the areas that the manager mentioned had to be pulled from the project area just because of those pressures.
Reason I was asking, I know several of these roads are east of that tank, so even all the way across Highway 16.
Yeah, now those areas all the way to the east of, eastern section out there towards Highway 16, they'll stay on that fairgrounds pressure zone most likely. But a new division point somewhere on Rink Dam Road will have to be determined through some, hydraulic modeling and evaluations with the city.
Sounds good.
Anyone else? Thank you.
It's also important to know this is the way that the county has planned to spend its ARPA funding.
Yeah.
Mm-hmm.
Yeah.
All right, at this time, do I have a motion to close, or no, we're not in public hearing, I'm sorry. Let me get back to my screen.
Just a motion to award.
I make a motion to award the bid for the Opera water expansion.
I'll second.
Got a motion and a second. All in approval, raise your right hand. Unanimous.
Yeah.
Motion carries. Thank you, sir.
Thank you all. Have a good evening.
You too. Yeah, I've got a public hearing.
Anytime we can spend somebody else's money.
At this time,
Water,
We'll do it.
I'm all for it.
Sterling Road, CDBG Project Engineer recommendation given by Paul Tigg.
Good evening, Commissioners, and we had to, originally we were trying to do the Sterling Road paving project. It was discovered during the initial process that that road had been measured incorrectly, and so we had to go back and get additional funding for that. We did receive that additional funding in January, which allowed us to then send out requests for qualifications for engineering services. We did receive 4 proposals. Following review and consultation between myself and David Moose with the county, the recommendation is that we go with West Consultants for engineering services. They will come back, I will come back to you at the April meeting with a contract proposal for those services. Those services are paid for through the CDBG grant, and we're going to get this project moving at a much faster pace. The additional funding that we did receive, we also received an extension on this project through August 20th of 2026. That is a hard deadline. And once we get to a bidding portion of this for a contractor, we will make that very, very clear that this project really needs to be wrapped up sometime in the early summer. So
I agree. They definitely need to be made aware that that's a hard date.
yes, because that additional funding that we received was from de-obligated funds from previous project dating back to 2019. So I guess it does have an expiration date. But again, it is our recommendation that we utilize West Consultants. I know they've done several things for Alexander County in the past, and I think might be working on a project at this time as well. So have a lot of confidence that Benji Thomas and his team will be able to see this through.
Well, I'd reiterate too, I'd like to see this done. I know it was back in probably 22. I think the mayor, George, he's gone now, but he brought a paper to my house and said, if we can sign this, it'll be done. And man, it's like it keeps coming up all the time, and the people that live on that road are really, putting up with a lot, that should be done. So hopefully you think this is the last little,
I am very hopeful that this is the last speed bump, that maybe we can say that there is light at the end of the tunnel, and it is not an oncoming train. It truly is light. So the people of Sterling Road have been immensely patient. I apologize for these delays. There was a mistake made in that initial calculation, and that caused a considerable change in the overall timeline.
all right, thank you.
One question, I've been asked, once this road's finished, who'll keep the maintenance up on this road?
Well, the road is going to be built to NCDOT specifications. As to who the maintenance falls under, it is my understanding, I believe that road is within the Taylorsville ETJ, but it is not contiguous to any adjacent type of properties. That is just something that will be determined.
That road connects to Radio Road, correct?
Correct, and I believe that is an NCDOT maintained road. We will strongly encourage NCDOT to take over maintenance of that road, but we can't make any promises.
Well, currently, Radio Road is absorbing Sterling Road every time there's a downpour.
Yes. Yeah, I think that one of the single biggest challenges in this paving process is how do you handle that entranceway where it drops off pretty steeply.
Yep.
And so there's going to be a lot of discussion about water collection.
Sounds good. Get it done.
Also, while I'm here, I do want to give you an update on the Paragon Films project, Economic Development, CDBG. The rail has been installed and is fully operational, and we're just in the process of trying to close out the first sort of portion of this. Because it is an economic development project, there will be some annual reporting and monitoring of the job creation that is also required as a part of that grant. We do anticipate fully paying the contractor within the next week or so, and we're going to be drawing down the funds for Alexander County on that project.
Thanks for the update.
Yes.
Thank you.
Mr. Chairman, I'd like to make the motion to approve West Consultants to provide the engineering service for the Sterling Road CDBG project.
Second.
We have a first and a second. Any other discussion? If not, all in favor, raise your right hand. Motion carries unanimously. And I am 100% positive that the folks that live on Sterling Road will love to hear and see this occur and be completed once and for all. This time, Josh Mitchell, Public Works Facilities Director, will give us or come to us in regards to EMS Base Number 1 Facility Project Bid Award Recommendation.
Good evening, Commissioners. We recently received bids back for the EMS addition at Station 1. The base bid is a 4,500 square foot, 5-bay garage. In that garage, we will house a QRV, 1 primary ambulance, and the backup ambulances. Currently, the QRV and the primary ambulance are stored in a metal carport out back, and the backup ambulances are just sitting out in the weather. So that's the base, and there'll also be storage for medical records and equipment in that space as well. The alternate bid is the 5-bay garage plus 4,500 square feet of office space and a training room. It would house admin, billing, training officer, port, community paramedic, and the director. It would also have a medical supply and medication room and It's really going to help these folks out to have their own training facility. Right now, they are currently using the Alexander County Rescue Squad. If you've ever visited EMS 1, it's pretty crowded over there. So a total of 7 bids were received for the new EMS 1 station building. David E. Looper Incorporated was the lowest responsible bidder with a base bid amount of $795,000. The alternate bid, which includes the garage and the office space, was $1,431,000, and an add alternate bid in the amount of $3,842. David Looper Incorporated is appropriately licensed with the North Carolina General Contractor Licensing Board and has completed many similar projects. Therefore, it's recommended that the county award the project to David E. Looper Incorporated in the amount of $1,445,153, including the alternate bid of $3,842 and the performance labor and material bond of $10,311. It's also recommended that the county establish a construction contingency in the amount of $72,257, or 5% of the contract price. This is to cover any quantity overruns or unforeseen circumstances. And you guys have the bid tabulation there in your packet. So I'll be glad to answer any questions you may have.
So, David Looper, that's his turnkey price. That would be for the garage door light, sensors, all of that, and the office part of it.
Yes, the $1,445,153.
Okay.
Then you have contingency on top of that that I spoke of for unforeseen things.
Okay. Mr. Chair, County Manager, how much money were we awarded for that project from the state?
$750,000 if memory serves me correctly.
Okay.
And then some of this money will be paid for out of the, for the port offices will be paid out of the opioid money as well.
Okay, thank you. It's pretty needed in my mind. I think, we need to have a place, that's our hospital. We need to take care of, our ambulances and the ones running them, so. It's a lot of money, but you can't get anything done inexpensive or cheap, so.
Mr. Chairman, I'd like to make a motion, we approve this, the EMT base number 1 facility.
Second the motion.
We've got a first and a second.
Can we clarify if they want the alternates as well?
We do need to clarify, Mr. Herman, is your motion for the alternates to be included?
Yes, sir.
And your second was for that also?
Total project, yes.
Okay. Any other discussion?
I just, one question, I know the opioid settlement money, I mean, it's, I don't remember the numbers exactly, but it's, it's some amount for so many years.
Yeah, we get so much every year. I mean, over time it decreases a little bit. I believe it's either 15 or 18 more years that we get those monies. And it has to be spent on certain things. It can only be spent on certain things. That's why only a small portion of this will come from that. It'd be for the port offices and the stuff that will directly affect fighting the opioid addiction. The rest of it will come from the general fund.
I'll say just so rough estimate coming out of general fund, probably $500,000. Just, just throwing that,
It'd probably be more than that. The budget amendment, as I understand it, will be next month. Is that correct, Jennifer? Excuse me. It's in this month, correct?
Yeah.
Sorry. We've been working on budget all week, so.
So that information, so we have that information.
Yeah, I'll pull it up in just,
If I can get my dang,
957.
my iPad would cooperate.
I have my notes at my office, and I'll take them in my office.
The increase in the EMS. According to what I've got, it's 957.
Yes, so $957,500 will be transferred out of the general fund. 300 will be paid out of state grant, and 750 will be paid out of another state grant.
It's freezing up and doesn't you?
If you want to look at it, it's budget amendment number 29.
Right.
Mr. Chairman, just to clarify, the reason I made the motion to approve this is like Mr. Reese said, that's the only emergency room we got is these ambulance bases. And our population's getting older in this county, and there's more and more calls. I think we've been pretty fortunate so far that we've got along as well as we have, especially storing medicine, keeping these ambulances plugged up. This will just ensure that things could run a lot better. So that's the reason for me.
As you mentioned, there are electrical issues with these ambulances that we keep outside. We have to keep them plugged up to the shorelines. And one of the big problems is in the winter, you're running a cooler drawer and a heater as well. And they're on GFIs, so that pops all the time. So that's one of the big issues with the way we are housing these ambulances currently.
All right, so we had a motion and a second, and this is for the base and the alternate. At this time, raise your right hand if you approve. Motion carries unanimously. Thank you, Mr. Mitchell.
Thank you.
We got budget ordinances, amendments 25 through 31, and project budget ordinance P-3, Soil and Water Stream Flow Rehabilitation Assistance Program, given by County Manager Todd Herms.
And again, as I mentioned earlier, I left my notes on my desk at my office. So I'm going to run through these right quick, if I can get it to pop up. The first budget amendment, number 25, a lot of these are for grants that we have to take money in, so it's not necessarily we're spending more money out. The first one is there's 2 grants and 1 donation for the library and the senior center. We received a grant, library state aid grant, and then we got a donation as well for the library. And then for the senior center, we got a fraud protection state grant for $16,800. That's to help educate the seniors about potential people trying to get money from them through text and emails and stuff of that nature. And then and then we also got a general purpose grant for $36. That is number 25. Number 26 is a budget amendment to true up adjustments to pay out to from through June 30th of 2024 fund balance and amounts of the different fire districts we have in the county. Number 27 is from the county water and sewer fund to cover the projects that we talked about earlier. Number 28 is also that as well, with some ARPA funding and CGBG funding for Sterling Road in the EMS base. Number 29 is the EMS base as well. Number 30 is the budget amendment for some of the water lines that we talked about again, from the ARPA, the ARPA funding, in the amount of $2.3 million, we might as well say. And then number 34 is finishing up the CDBG grant through the Department of Commerce. Project budget ordinance P3 is for us to receive an $85,714 grant from the North Carolina Department of Agriculture and Consumer Services Grant, or STRAP.
What's the pleasure of the board?
I make a motion that we approve the budget amendments as presented.
Second.
First and second, all in favor, raise your right hand. Motion carries unanimously. At this time, do I have a motion to accept the consent agenda?
Make a motion to accept the consent agenda as given to us in our packet.
Second.
All in favor, right hand. Motion carries unanimously.
Mr. Chairman,
Yes, sister.
just to back up just a minute there about the soil and water and the stream removal stuff.
Uh-huh.
I got a phone call today from the ASCS office, and just so you might know, this is not going to be through our soil and water, but the Army Corps of Engineers is starting to reach out in this area to the landowners that have property right along some of these main bridges. So the landowners may be contacted to, for them to go in and remove some debris, probably 100 foot is what I was told, along some of these bridges.
That's good info. Let's see. At this time, we will transition over into our Consolidated Human Services Board meeting. And do we have any public comment? No. All right, Billy Walker, Health Director. Before you start, Billy, if anybody's looking to leave, this would be a good time unless you'd like to stick around for our Human Services Board meeting. Podium's yours.
Good evening. I'm going to do the public health report for the board this evening, and I'm going to start with the organizational update. I'm going to go over our current vacancies and our staffing update. We still have the advisory board members that we need, engineer and ophthalmologist. And then for our in-house, we have the need for the behavioral health licensed clinical social worker, and we have an opening for a public health nurse in our care management for at-risk children, and that's also known as the CMARC. And then the dental position is the school-based dental coordinator. I'm going to discuss some financial updates. We've been working hard on the fiscal year 2026 budget. We attended the budget kickoff meeting, and we submitted the first draft of the budget to finance on Friday. The next thing I'm going to talk about is fee approvals. This is an accreditation requirement. You'll see on the next slide. Due to Medicaid and Medicare rate of reimbursement going up, our COVID testing, we're going to ask for y'all to approve us going from $25 to $50. And I think I sent that to Jamie for y'all to sign.
Question on the 25 to 50, is that to cover the testing fully or a portion or what?
Covers our cost.
Do we have a motion from the board to accept?
Make a motion to approve the changing of the fees.
I'll
Second.
Kent, did you start to say something?
Second.
Okay. All in favor, raise your right hand. Motion carries unanimously. Carry on.
The next thing I'm going to go over is the annual board member training. None of y'all are new members, so I'm not going to do orientation, but we are required, since you're our Board of Health, for annual training. So you've got your manual, I hope, still at home. So I'm not going to give you another manual, but I did send on the 3rd in an email, I sent the documents that you were needing to review. So due to accreditation, these are required. So it's accreditation 36.1, 36.2, 36.3, and then 34.1. Those are all the accreditation benchmarks that talk about your roles and what you do for us as our governing body. So the documents that we sent is the operating policy and procedure, the Consolidated Human Service Board orientation and ongoing policy, ongoing training policy, and then the policy on policies. It's a lot of policies. So I sent those for y'all to review, and then the two items that I will need each of you to sign is the Consolidated Human Services Board Annual Review Acknowledgement Statement and the Annual Review Guide for 2025. Any questions on all that? So the next thing I'm going to go over is also an accreditation requirement. It's the SOCH report, the CHIP report, the strategic plan, and I'm going to give you a CHA update. And we also sent this via email on the 3rd for you to review as well. And you don't need to vote on this. You just need to let me know if you have any comments or any changes you want us to make. So on the 2024 SOCH report, this is just an abbreviated version of the CHA. This is due every year between the years that we do the CHA. And the CHA is every 4 years, so of course, the years we don't do the CHA, we have to do the SOCH report. And so our CHA priorities were mental health, substance use disorder, healthy living, and child and parenting. And we use this to educate and update the community leaders, and partnering agencies and organizations. The biggest thing that we want to make you aware of is that we discontinued elder care as a goal and priority. It was number 5, and the state just told us that 5's too many to work on. And since we have an active senior center and we work well with them, they handle that piece of that, so they wanted us to discontinue that portion. I also included the website where you could find all these reports if anybody wanted to go and look that up. I included the things that we did for each of those 1 through 4. So instead of reading those, I'm just going to let you look at them. We have done lots of trainings in the community over the last couple of years. We're slowly coming to the end of the CHA. And I'm going to talk about the new CHA coming out. So some things that we have done that have been a good thing is, number 2, we gave out 38 medication lockboxes free to the community. We also worked with the EMS port team and the community paramedic team to do the Detect and Reflect project. And we also still go into the high school and teach risky behaviors. And we started going to CVCC. I'm going to go to the next slide. The CHIP, that's the Community Health Improvement Plan, and this is just something we have to tell the state this is what we're working on. It's kind of a repeat of the information, but I just added the highlights. There really were no significant changes in our morbidity and mortality. But you'll see that heart disease is still our leading cause of death. Cancer is the second leading cause of death. And motor vehicle accidents and accidental falls is also high on our list. Lung cancer is the highest cancer for us, for our county. Emerging issues since the last CHA, and this is huge for us, is the suicide rate. The state was 15.9, but Alexander County is 21.9, so that was huge. And I think, we don't really have a lot of mental health counseling services or resources available. So that's a big one for us. We need to really look into how do we get more resources for mental health issues. And I've already gone over the elder care was removed as a priority. The next thing I'm going to go over is the strategic plan. You have to review the strategic plan, and the only thing that this is every year we go in and for 4 years, we put what we do each year. So again, we took off elder care, and we put what we've done each year to meet the goals 1 through 4. Any questions on those before I go into the CHA update?
I do have one question.
Okay.
In regards to the suicide rate,
Uh-huh.
explain the 21.9. Is that,
It's just we've had a large increase of suicides in Alexander County.
do you happen to know how many in 2024 by chance, just off the cuff?
I would have to get that data.
I'm just
I
trying
don't
to
have it
figure
on
out
me.
what kind of rate we're talking about here, because that definitely couldn't be a percentage. Because that would mean 21.9% of our population.
I'll have to get it from where she pulled the data.
Okay.
Yeah. We get it off of the state's website for Alexander County.
If you would shoot that to.
I will. I'll add it.
County manager's email.
Okay.
That seems really high,
It is. I mean, it is high for us.
because every 22 minutes in the United States, a veteran commits suicide.
Yeah.
I hope everybody heard that. Every 22 minutes, one of our veterans commits suicide. It's terrible. Suicide is just a selfish way. Selfish, and that's something that we all need to be aware of and pay attention to, especially for our veterans and those people that need assistance. If you see something, say something about these people, because you never know what's causing that. It's a bad situation. But one of the things we heard in Washington that was very, very vital, I know this may go away just a little bit, but it touches home to me to understand that we have veterans, 22 minutes, a veteran's killing himself or herself. And we really need to pay attention to these people who are having problems. And sometimes, it's hard to step up and say something, but if you see somebody that's having a problem, talk to them about calling the 800 number. It'll help. It'll help. I'm sorry, but I
No,
had to say
you're
it.
good. No, you're good. You're exactly right. Community health assessment update. We are still working at the end of the 2022 community health assessment, but we are pushing out for the 2025 community health assessment. The initial process for the secondary data has been complete, so now we're working on the primary data, and that is the survey tool. We are doing PSAs, we are utilizing the churches. We're working on getting some of our church youth groups so that we get a younger population. We're wanting 15 to 19-year-olds. We're really trying to, last time when we put this out, I think we got less than 600 people total. So we're really wanting to get lots of members in the community to either use the QR code and do the assessment or do the paper copy. And we've shortened it this time because we were told last time it was too long. But this is something that's going to help us gear what our goals are for the next 4 years. And I know one of the comments I think I saw on Facebook was the need for a hospital. So they can type that in at the bottom. So, just what their needs are for their health and in their community, what they think resources are needed. That's what we're looking for. So today, I looked right before I came, and we have 720 already filled out, which is wonderful. 26 of those are not in our county, so we can't use them, but 694 of those are viable. So we're already ahead of where we were for the total last time. So I'm wanting to get 10% of the population, and that's a stretch,
You
but
say 10?
I'd love to get 10%, yes.
Good luck.
I know, but, you know, you've got to get a large number to get a good view of what's going on in your community. So, I'm asking y'all to share, the QR code. I'm handing out, a lot of the paper assessments. If you've got, civic groups or your churches are willing to fill it out, let me know, and I'll bring paper copies, and then I'll pick them up. But other than that, if you don't have any questions, my portion's done.
We'd like to encourage everyone sitting out here this evening to share this on your social media. I know everybody loves social media, so it could be something productive, and the more feedback that Health Department receives, the better off they could guide and serve in Alexander County. Thank you.
Thank you.
Thanks.
At this time, Carrie Gerald, DSS Director.
Good evening, Commissioners. I have with me this evening some of our social worker supervisors, our CQI department team, licensing and foster care, adoptions, assessments, foster care. But this is Social Worker Appreciation Month. And I just wanted to, y'all can come this way, you know. I just wanted to bring them with me so you can see their faces, and to thank them publicly for everything that they do. As Tennille mentioned, we are short-staffed still, and they wear a lot of different hats, but I just wanted them to know how much I appreciate them. Thank you all.
Thank you.
Okay, so I won't be before you long tonight. I just wanted to give you some brief updates on our performance metrics for adult services, economic services, and child protective services. So the first graph that you will see, where it says number of youth in foster care, they're talking about foster care ages. The number of foster care children that we have currently is 46. I take that back. It's 48. We had to bring a couple more in care since this was created. We have 10 children in our LINKS program, and we have 3 children in the 18 to 21-year-old program. The second graph, it's discussing how we are actually, our children are leaving foster care, which is a good thing because they are gaining permanency. So right now, Alexander County, we're very low as some of our other counties, our neighboring counties. So again, we have 48 children in care, and as you can see, that rate is decreasing. And it's because children are getting permanency, either by kinship placement, guardianship, adoption, but they're able to gain permanency. Next slide. Which brings us to our foster parent training. So we are offering a MAP class April 22nd, I believe, but we're having an informational session March 17th. It will be at DSS at 5:30. You can call 828-352-7619, or you can scan with your Android or iPhone the URL code right there, and it will bring up the website. You can register. Don't be afraid. If you are someone who works at the Sheriff's Department or EMS or any type of law enforcement, whatever type of job it is, don't be afraid to call us. If I have to do deciding together, we offer 2 different courses. So you can have the MAP training or Deciding Together. And Deciding Together is where someone will come to your house and they will meet with you one-on-one. So please, if this is something that you're interested in doing, but you're afraid because you work a lot, we can work around that as well. Next slide. So now we'll talk about our APS key performance metrics. As you can see, APS is doing extremely well. They are over their goal of 85%. So the state has measured, their measure is 85%. We are well over that. We're 95% for abuse and neglect evaluations, which means they're going out and they're initiating those in a very timely manner. Our exploitation evaluations were at 97%, and the goal is 85%. So we're exceeding our goal. Next slide. With our special assistance for the aged applications, we're at an 89% timeliness rate, and again, we're exceeding the goal that the state has measured us by. With our special assistance for the disabled applications, we're at 91 timeliness, which is very good. Economic services, key performance metrics, we're doing very well, as you can see. We were put on a cap for food and nutrition, and that was because there were some issues concerning voter registration documentation. We have since corrected that issue. So now we have a template. So when you look at the application now, that question is on there, the very first question. So we have corrected that deficiency. With our special assistance cap, there was a problem with the application. The forms 8190 and 8191 were not being completed fully, but we have since gotten that taken care of. Supervisors will be reviewing all prior submissions now. Economic services, we have Chong Taylor. Child welfare, Matthew Deloach and Teresa Murdoch are our social work assistants. Our current vacancies, as you can see, we're still hiring for foster care, and there is an adult protective services position being hired for as well. We're hiring for a social worker supervisor also. You can apply online, which is really good now. So you just go online and you can submit everything there. I would like to add, we have filled 2 of the foster care social worker positions. One person is coming from another county, which means she is already pre-certified. So she will be ready to start without having to go to pre-service. Any questions?
I don't think so. Thank you.
Thank you.
Thank you, ma'am.
Thank you.
Thanks.
This time, Senior Center report will be given by Vicki Martin, Assistant Senior Center Director.
And our last team member that joined us, she's also going to be with us tonight. Christy said to tell every one of y'all hello, and she wanted to come. She just didn't think she could sit that long without having her feet propped up. So being out is definitely killing her. Our senior center activities. Well, I'm waiting. Can you click it?
Yeah, you got
Thank
it.
you.
Got
There
it.
we go. The senior center activities that we're doing, we are adding new seniors every month. I know y'all have heard Christy say that we are outgrowing the building, and we really are outgrowing our building. We have our bingo and birthday lunches, and they continue to fill up we do them on the first working day of the month, and they can come in to pay for their birthday lunch and call for the bingo. Takes us about 20 minutes and we're done. They are full. The seniors, they really enjoy these, and they enjoy the outing and just getting together to be with each other. We also continue to offer evidence-based classes such as a Matter of Balance and the Tai Chi. Western Piedmont Council of Government is currently teaching Tai Chi in Bethlehem.
So speaking of our Western Piedmont Council of Government, we have added a computer class to Taylorsville for every fourth Wednesday. This can help the seniors with their online bill pay, housing recertification, online appointment scheduling, shopping, and much more. With that, we had a great turnout for Taylorsville, so we added a class to our Bethlehem location. So that's going to be every first Tuesday of the month. And then we had a computer class that was offered by CVCC, and we took 20 seniors on January 22nd, and they participated and they all came home with a free laptop. So we have got that opportunity again, and I will be taking them on March 20th, another 20 seniors, and they will get to participate and come home with a free laptop.
They take a 2-hour class. They have to sit with the 2-hour class over there, and they get a free laptop. They're refurbished, but they're already loaded and ready for them to use.
It's still a laptop.
It is still a laptop. They are thoroughly excited about getting these. And the classes that the Western Piedmont is teaching, the lady was very good. She took the laptops, she let them bring in the first group, let them bring it in, and she worked with them to help them. Because some of them just, they don't work with them, you know. So it's just a learning experience all over for them. But she was very good with them and was showing them how to use them. So it's been a good one. And that's been a good thing for them. The Taylorsville Christmas Parade. This was the first time that the Senior Center has ever been in the Christmas Parade. And the group that is up there right now, they are doing cardio drumming. I don't know if any of y'all have been by the Senior Center to see this, but it's a good workout, it's good exercise, it's lively, and as you can see, they're all laughing, and that's because they had a blast doing it. And I think we probably had the most pictures taken, because everywhere we went, there was cameras, on either side of the road getting our pictures as we went down through there. So it was really good for all of us. We enjoyed this. A little cold, but it was good. Our Christmas celebration this year, if y'all have ever played the game Dirty Santa, you need to come to the Senior Center just one time and play it. If you see that picture right there where all those people look so nice and calm, they're not. They will come after you if you have what they want. And they'll hide it too and not act like they don't have it, till the very end, and then they'll pull it out and go, "Oh, look, I got to keep this gift card. How great." And you're like, "You did." They were like, "No, you didn't show it." So that is wonderful. They have such a good time. I wish y'all could come and enjoy some of the stuff with them. They do have a wonderful time there.
Okay, so our Senior Center Partner Services. So we work with the AARP Tax Preparation. They are there every Saturday from February 1st until April 12th, and they assist people with their tax filings for free. And we have booked up very quickly. We make the appointments for them, but now that we are booked, we have other locations like Wilkes and Hickory that we have been giving the contact information so they can book up as well. We also work with the Lee Masonic Lodge and Red Cross for our blood drives. We've already had one on January 17th, but we have already scheduled 2 more for this year. Also, Via Health and Wellness. They provide mental health classes every second Thursday of the month at our Taylorsville location, but they also offer virtual seminars as well. And then Alexander Hospice, they have a caregiver support group that they come out every 4th Tuesday, and they meet with all the caregivers to give them support that is needed.
And our diamond tour trips that we had chosen this year. The first one, the Grand Canyon trip, and going to Las Vegas and the Hoover Dam, they didn't want to go on it. It was too long. They were going to be gone too long, so they did not choose to do that one. So I was heartbroken because I was going to do that one. And the second one is for Pigeon Forge. That one's just gonna be a 2-day. So if y'all need a vacation and you wanna come go on a trip with us, we have a blast with us. And then the last one's gonna be for Vermont. We're gonna go there for September the 14th through the 20th. And that one I think is gonna be a beautiful trip. I think we're gonna, and we've had a lot of interest in that one. So I think that one's gonna go really well for us.
Okay, so we just recently had our Valentine's dance on Valentine's, February 14th. So we played games like spin the bottle, but don't worry, we gave candy kisses instead of real. And we also played Pictionary and Name That Tune and Hangman. We had a great turnout of 92 people. There was probably more than that, just floating in and out all day. And as you can see in the picture at the bottom, we even had our county manager come and help us serve. So he joined in on the fun. And for that event, we had the Green sponsor, so they got our food for us.
We also are getting ready to do a shred event. And a lot of people don't realize that you have a lot of papers that you just keep sticking back and, you know, if somebody in the home has passed away, you have all of their paperwork. And all of that needs to be shredded because people commit fraud every day. They steal information every day. And that's one of the reasons that we do these events where we do for the fraud. And we do try to help them. You don't realize how easy you can say, they'll ask you a question and catch you off guard and say, well, yeah, I bank at Wachovia, you know. And before you know it, they're telling information on the phone that they shouldn't be. Or somebody has gotten their information and now they're in a mess because they've stolen it. But with the shred truck, we're going to have that one. Our grant that Todd was speaking about earlier, the $16,000 grant that we got, we'll use that, part of that money for this shred event. And this is going to be on March the 21st from 10 to 1. We do purchase T-shirts for the seniors, and on the back of it, it has a lot of the information listed for the fraud. Also, we do help to purchase some other items that can help them, such as shredders. We usually have some shredders that we do for giveaways, you know, to help remind them at home, shred that information or burn it, don't keep it around. Alexander Partnership is also going to be there the day we do this. They do the pill collection because sometimes you have leftover medicine, you just leave it in the cabinet. That's a hazard, you know, for a lot of reasons. So they also do the pill collection. The sheriff's department's there when they're doing that. And we're going to have other agencies that'll be there that our seniors use on a regular basis. And we've talked to them about bringing information for fraud as well. So hopefully we will have a good turnout with all of them for that.
Okay, for our upcoming events, we did not have this on the PowerPoint, but our day trips are going to be starting soon. So I'm going to be able to start driving these seniors around everywhere. Our day trips that we're starting out with are going to be like going to the Mrs. Haynes Moravian Cookie Factory in Clemens. We're going to a paint splatter room in Hickory so they can let out their aggression and just throw paint. I thought that would be fun for them. Lazy Five Ranch, a new aviation museum, the Sullenberger Aviation Museum in Charlotte. And then, of course, Cody Creek. That's a big hit with them every year. And then Carolina Pie Company, where they'll get to make their own pies and bring them home. And then we're also going to try a new one, which is the Salt Cave in Lenoir. So that'll be beneficial for their health, but also they just get 45 minutes to relax and not think about anything or do anything. So I think these are going to be fun trips for them. So our senior celebration is coming up. That's going to be on May 16th. This event is held in conjunction with the Unifor Senior Games. We're going to have a fun walk at 9 a.m. and then music and games, a lot of fun afterwards. Our honey baked ham box lunch will be provided by the Greens, and our theme for this year is the Roaring Twenties. So we have already got our costumes, and we're prepared and ready with the feathers on our head and everything, gold, pearls, everything. And it is so fun listening to the seniors plan their outfits and get ready for it as well.
Actually, somebody's wife, when we said, do you know how to do the Charleston? She showed us how to do the Charleston. She sure did. So that's gonna be a good one. And as far as the senior games as well, since she was mentioning the senior games, they are from February the 26th through May the 2nd. This year, we're gonna hold an event at our senior center, and it's gonna be the Mexican Dominoes train. It's gonna be Rook and Pinochle. And so we'll have other counties coming in to our senior center to play these games, like we'll be going to other senior centers as well. And the Medisys event is a big one for us. With that grant that Todd was telling you about, we took the majority of that money to do this Medisys event. And this is for everybody. It is for our whole community. It's not just for seniors, but it does benefit anybody. They can go and get over-the-counter medicine, and that stuff's expensive. I don't know if y'all bought anything lately, but if you go buy Tylenol, it is expensive. So this is going to be something that is going to be wonderful for them. Our sponsors that come to our health fair, a lot of them are going to be there, so they're going to have information for them. We try to provide as much of the information that our seniors can use. I mean, we're the senior center, and yes, we do activities, but if you come in there and you need something, that's what we do. We provide what we can for them. And I mean, if we fill out a food stamp application, then we fill out a food stamp application. You know, or if I help you get your driver's license online, then we have a multitude of things that we do. But anytime we can get information for them, we do that. And this event is going to be wonderful for the county. So we're really excited about getting to do that. It's going to be on May the 30th at East Taylorsville Baptist Church, and it will be from 8 to 3. We have our Medicare Advantage Plan open enrollment is January the 1st through March the 31st. And so we're almost finishing up that this month. It's just like open enrollment for regular Medicare. It's just for the Advantage plans. So we have been having several to come in for that. And then the next page, this is the difference in the amounts that we had saved. For January to December of '23, our savings was $1,316,652, and we saw 1,122 contacts. For January to December 2024, we had a savings of $1,537,840, and we had contact with 1,364. We saw 402 people during open enrollment, and that's a lot, it really is. And that's a lot of money that we were able to save the seniors. The Medicare savings for January of 2025, just January so far, we've already had a savings of $32,702.
So with our participation from 2023 to 2024, our average daily attendance increased 39.5%. The next, okay. And then we're looking at 2024 to 2025. So our average daily attendance for January of 2024 was 73.67. And January 2025's average daily attendance was 107. So we can see an increase of 45.24% from just last year.
Any questions that we can answer for y'all?
Sounds like y'all are having a ball.
We have a ball over there. We really do. And you know, you ask some of the seniors, and they're there every day. Some of them come every day. They come for just to be with somebody. You know, just to be with somebody. It's not, they may play a game or eat a snack, but, you know, they just come and enjoy each other. And it's a good place to be. Anybody else? Thank y'all very much.
Thank you.
All right, at this time, we'll go into closed session per NCGS 143-318, A4, 5, and 6 for economic development, contractual, and personnel. We will only come back in session to adjourn. Do I have a motion?
So move.
Second.
All in favor, right hand. Carries unanimously.